You Are Very Salty Part 2, Blood Pressure. Low-salt diets reduce blood pressure, but not by much. The main narrative in the war on salt is that a low-salt diet is good for you because it lowers high blood pressure, hypertension, which in turn reduces heart attacks. A simple Google search will show some cherry-picked studies that show big drops in blood pressure on a low-salt diet. But a meta-analysis by the New England Journal of Medicine, including 34 trials, showed that a reduction in salt intake to under 4.4 grams per day was only able to reduce blood pressure by an average of 4 mm of mercury systolic, and 2 mm diastolic. This is a tiny decrease at the cost of some horrible health issues associated with low salt levels. A better way to lower blood pressure would be by losing weight. You can expect to lower your blood pressure by about 1 blood pressure point for each kilo of weight you lose. In a meta-analysis of 25 randomized trials, decreasing weight by 5.1 kilos reduces systolic and diastolic BP by 4.4 and 3.6 respectively. Weight loss should be considered the first step in all patients with hypertension, especially if overweight and obese. Regular exercise. A stronger heart can pump more blood with less effort. As a result, the force on the arteries decreases and blood pressure goes down by 5 to 10 points, even with just 30 to 60 minutes of exercise per week. This was from the American Journal of Hypertension. Increasing your potassium consumption. Potassium is mainly found inside the cells and works with sodium to control cell volume. Consuming more water and more potassium will mean lower sodium levels and less water retention. Potassium deficiency may lead to water retention, causing edema, swelling, and weight gain. The best way to get a higher ratio of potassium to sodium is to eat specific fruits and vegetables, plus the use of a low sodium salt. Thinning the blood. There are several natural ways to thin the blood. One is to take cinnamon, which contains a natural blood thinner. In a 2021 study in the Journal of Hypertension, cinnamon was found to be effective in weight loss and reduction of systolic and diastolic blood pressure in patients. Those who took cinnamon daily over 12 weeks experienced an average reduction of 5.4 in systolic blood pressure and 2.6 in diastolic blood pressure. Widening the arteries. There are many foods that can vasodilate our blood vessels, making it easier for blood to flow. These foods typically contain nitrates, such as celery. Or they contain the amino acid arginine, which breaks down to nitric oxide. In studies involving L-arginine supplementation, reductions of 11 in systolic blood pressure and 5 in diastolic blood pressure were seen. Quit smoking. It is a paradox that while smoking instantly increases blood pressure by 5 to 10 points, a slightly lower blood pressure level has been found among smokers than non-smokers in larger epidemiological studies. Reduce the booze. Alcohol decreases blood pressure initially, up to 12 hours after ingestion, and increases blood pressure after that period. Alcohol will also contribute to weight gain and so increase blood pressure over the long term. Get better sleep. The less you sleep, the higher your blood pressure may go. A 2014 study described sleep being relevant as the primary prevention of hypertension. Reduce stress. The body releases a surge of hormones when under stress. These cause the heart to beat faster and the blood vessels to narrow. These actions cause spikes in blood pressure and also higher blood pressure over time. In conclusion, people have become scared of salt because they believe a low-salt diet will lower blood pressure and reduce the risk of a heart attack. It's so much easier to implement some lifestyle and food changes to really drop the blood pressure. But low salt intake causes huge problems that far outweigh any issues with a higher salt intake. 11 grams of salt a day seems to be optimal. If you sweat a lot, you will need more. But always check with your doctor first, as they have a history of always being right. If you enjoyed this short video, please click the like button and subscribe to the channel to see more.